My name is Banele Bapete and I'm your host. In recognition of Glaucoma Day, today we are focusing on condition often referred to the thief of sight. Joining us today is Dr. Junaid, an ophthalmologist based at Zamet Modderfontein Private Hospital with an extensive experience in diagnosis and management of glaucoma and other complex eye conditions. Dr. Zondi, thank you for joining us.
Thank you.
Let's begin by unpacking. So, Doc, let's talk about risk factors and early detection. Who is mostly at risk of developing glaucoma?
All right, so there's a couple of risk factors.
Okay.
I will name a couple. So, older age, first of all. So, patients that are usually above the age of 40 are already at risk.
40?
Yeah, above the age of 40. Okay. Oh, you're getting worried there. So, and then also other important risk factors are family history. So, if you have a positive family history, if somebody in your family, your parents, your grandparents have glaucoma or have a history of glaucoma, that's quite a risk. Being short-sighted, that's myopic, is also a risk factor as well. And then there's some systemic conditions as well, like diabetes and hypertension that also put you at risk of getting glaucoma. These are some of the major risk factors that put at risk, yeah.
So at what age should one start screening? Interesting.
Look, I mean, like ideally, like if you've got, if you don't have a family history, a positive family history, from about the age of 40, you should probably start screening. This is for everybody.
Is it not too late?
Look, so if you do have a positive family history, I would say at the age of 20,
yes,
around your 20 years of age, you should have at least one examination, especially if you don't have any risk factors. At around the 30s, have another one as well. And then from the age of 40, probably yearly.
So on a non-risk factor people, what are the early signs?
Look, as I said, it's a silent thief of sight, so there are no early signs. So there is nothing that is going to tell you that you've got glaucoma besides having a comprehensive ophthalmological examination. So if you are concerned, definitely that's the first step to take.
Doc, let's talk about the bigger picture. What happens if glaucoma is left untreated?
Oh, so definitely lack of treatment will, not even can, I would say will lead to irreversible nerve damage. See, the optic nerve has got these nerve fibers, small little nerve fibers, and if those are damaged, they cannot regenerate. So if they cannot regenerate, that means the vision loss that you can get from glaucoma, it will not be reversible.
So how important is the compliance with treatment?
Extremely important, extremely important. In fact, with that being said, I've got personal experience with this, with patients that have been diagnosed before, but patients not understanding the concept of treatment, especially if you are presenting already having some sort of damage to your eyes. The idea of the treatment is to prevent further damage, is to prevent the progression of the disease, but not to improve your vision. So now you get patients that take these drops and they see themselves taking drops for long periods of time and they feel like, these drops are not working because my vision is not improving.
Yes.
But understanding that concept, and that's the drive home information that we are trying to get to there, to understand that treatment is extremely important and you should not stop treatment, otherwise you will go blind.
You mentioned understanding of the conception. So what is the major misconception about glaucoma?
So look, I think the one major misconception that patients have about glaucoma is that, oh no, I'm going to notice something going on with my eye. I'm going to notice symptoms with my eye. If something is wrong with my eye, something I'm going to know, you know? And that's the unfortunate part, that you will not know. Up until you go and get an examination, you will not know. So the regular exams are very, very important.
Doc, let's talk about diagnosis and management. How is glaucoma diagnosed?
All right, so the diagnosis requires a comprehensive eye exam. Because the condition is such a silent thief of sight with not much symptoms, we use eye doctors or eye specialists. We use a whole lot of certain tests that we use in order to diagnose the disease. So first of all, you'd come to an eye doctor. We would do a visual acuity. That is something that just sees exactly how good or how bad your eyesight is. We would do something called tonometry. Tonometry is the actual measurement of the pressure of the eye.
Okay.
We would do ophthalmoscopy. Ophthalmoscopy means using light and certain lenses to have a good look at your eye from the front to the back. And we've got special lenses that actually look at the nerve and see how healthy or how unhealthy your nerve is.
Interesting. So once diagnosed, can the vision loss be reversed?
So no, definitely the vision loss cannot be reversed. The damage that's done to the optic nerve cannot be reversed, and that's the reason why regular eye examinations are such an important part of glaucoma management.
So what treatment options are available? Eye drops, laser, or even at worst case scenario, surgery?
100%. So you've mentioned some of them, and yeah, so it's a stepwise process in the sense that initially you would start with the less invasive things like topical medication, which are drops. Okay, so that's what most glaucoma patients are on. I would say about 90% of glaucoma patients are on drops. Then we'd go to other things like laser. There's certain lasers like ALT laser and SLT laser that we can do to the eye to try and decrease the intraocular pressure of the eye. If these lasers are not working as well, then the final step would be surgery, which is basically the most invasive out of all of these.
So when do you decide that now it's time for surgery?
100%. So surgery, as I say, it's usually the last option, but of course based on certain things. It's based on patient factors and of course in terms of how responsive the medication is. So if we are getting to a point where with maximal medical treatment you are not responsive, including laser, then of course we're going to opt for surgery. Or in circumstances where there is still progression of damage despite adequate medical treatment, then surgery is indicated.
So after surgery, do I go home the same day or I have to sleep over?
Well, it depends. I mean, with most ocular surgeries, it's usually day procedures.
Day procedures.
So it's very likely that you will not sleep over.
Okay, thank you, doctor. So doc, referral and clinical collaboration. When should a GP refer to the ophthalmologist?
Aha. So I think that GPs should refer to an ophthalmologist if they happen to find a patient with an increased intraocular pressure, because most GPs will test intraocular pressures in their rooms. If a patient is complaining of some sort of symptoms, especially in closed-angle glaucoma, patients would usually have pain, ocular pain and headaches, etc. So they should refer them. If a patient has a positive family history that the GP is aware of, that's a good time to refer. And of course, with advancing age as well, if a GP is seeing a patient over the age of 40, over the age of 50, I think it is prudent to just refer to an eye specialist as part of their routine examination.
So it means that it is important for a multidisciplinary management of the patient.
Definitely, multidisciplinary managing is important. I mean, the condition itself affects so many areas in a patient's life where they'll have to change their lifestyle, they'll have to do certain things that might be different. Even occupational therapists get involved in this. So a multidisciplinary approach is very important when it comes to holistically treating a glaucoma patient.
All right, thank you for that.
Also, if a GP encounters a patient with suspicious optic discs and optic nerve changes, that's also a good time to refer. As well as if the patient has any visual field defects as well. These are all signs of glaucoma or possible glaucoma that a patient might have.
So, Doc, if there's one message that you'd like to give to the public, that one message, that take home, what could it be?
All right. So if there's one thing that I really want patients to take home on this World Glaucoma Day, is this. Get your eyes checked regularly. Get your eyes checked regularly. Glaucoma develops insidiously, and initially there is no signs or symptoms. In fact, patients do not know they've got glaucoma up until vision loss has already occurred. So, but the one good thing is that with early detection and early treatment, vision loss can be prevented. So an eye exam is the one thing that could make the difference between keeping your sight or losing your sight.
Thank you for joining us today on this World Glaucoma Day. So how do we get in touch with you?
No, thank you very much. It's been my pleasure being here. So in terms of getting in touch with us, no, we are definitely online at drjunaidzondi.co.za. That's where you'll find us. And then, of course, in Johannesburg, we are based at Busamed Modderfontein Private Hospital. That's in Modderfontein. And then, of course, telephonically, our numbers are 010-746-0190, or alternatively 066-462-0736.
That was great. Thank you so much, Doctor.
It's a pleasure.
And that was Dr. Junaid Zondi, our specialist ophthalmologist. Thank you for joining us on our first clinical exchange series. Please look out for more on our social media platforms.